Hi everyone, I welcome you in our YouTube channel SRIP Edu Pharma. The topic of our today's video is controlled release formulations based on ion exchange principles. In today's video, we will be discussing what are ion exchange resins, the classification or types of these resins, the mechanism of formation of ion exchange resonates, then the properties related to it, the preparation of resonates, and at the end the applications of these ion exchange resins. Now we will be starting our video. So first of all we will understand what are ion exchange resins. So these are cross-linked water insoluble polymers carrying ionizable functional groups. The basic concept is that we have to remember is that they are water insoluble and they are used for taste masking and various type of control release systems. For preparing control release, what we will be doing is the formulations are developed by embedding the drug molecules in the ion exchange resin matrix, and this core is then coated with a semi-permeable coating material such as ethyl cellulose. In the previous video, we had discussed the approaches related to dissolution and diffusion techniques. In that, we had studied the matrix type delivery system. So in the same matrix type delivery system, what we are going to do is we will be taking the drug with ion exchange resins in the matrix form inside the core, and then it will be coated outside with the semi-permeable membrane. Here example is given ethyl cellulose. We can use other polymers also as coating material. Then what this system will be doing? This system will reduce the degradation of drugs in the GIT. Then it is also used as for taste masking, odor masking. Then for the main purpose of this linking, what we use is we use divinyl benzene sulfonate. So the most widely used and safe ion exchange resin is divinyl benzene sulfonate. In tablet formulations also, ion exchange resins have been used as disintegrant. Now we will discuss the basic principle related to ion exchange resins. Basically, ion exchange resins are of two types, cation exchange resins and anion exchange resins. Before that, you must know what is cation and what is anion. In any neutral atom, when there is loss of electrons, then the cation is formed, and when there is gain of electron, then anion is formed. Then here when we see the cation exchange resins, then the resins which exchange the positive ions, they will be called as cation exchange resins, and the resins which will exchange negative ions will be called as anion exchange resins. But in the inside core, in the cation exchange resins, there will be sulfonic and carboxylic functional groups as an integral part of the resin, and an equivalent amount of cationic, that is positive drug molecules, will be present outside, which will be exchanging with the ions of the drug. Then for anion exchange resin, in the core it has quaternary ammonium groups and polyalkyl amine functional groups as an integral part of the resin, and then similarly the equivalent amount of anionic or negative drug molecules are present outside, which will be interchanged with the negative ion of the drug. Now we will see schematic representation of the principle that we have discussed just now. If we take sodium chloride, a drug, and then we will be attaching here with, we will be reacting it with cation resin and anion resin. Here cation resin will have H positive at outside boundary, and anion resin will have negative ion, that is OH negative. Now when the ion exchanges occur, then in place of H positive, Na positive will be attached, and in place of OH negative, Cl negative will be attached, and ultimately water will be evolved. So this is the example of ion exchange that occurs here. Now we will see how ion exchange complex or ion exchange resonates are formed. When the drug reacts with ion exchange resins, Then the complex formed is called ion exchange resonates. The polymer backbone contains the functional groups which identifies the type of ion exchange resin, and the functional group is known as fixed ion. To the fixed ion, there are attached oppositively charged counter ions. These counter ions are exchangeable with ions of similar charge present in the surrounding solution. Thus, these polymers are called ion exchange resins. Hope you have understood the ion exchange resonate concept. Now we will see classification or types of ion exchanges with the example. As we have seen previously, there are of two types, cation and anion. In cation also there are strong cation and weak cation. Strong cation exchanges have sulfonic acid resins. Example is Dovex 50. This is the commercial name of strong cation exchanger. Then weak cation exchanger example is carboxylic acid resins. Example Amberlight IRC 50. Then strong anion exchanger has quaternary amine resins, and example is Dovex 1. And weak anion exchanger example is tertiary amine resins, example Amberlight 11R4B. Now we will see the important properties of ion exchange resins. As we have previously seen, they are polymeric compounds. They have high molecular weight. They are water insoluble. They have cross-linked polymer matrix. Then cross-linking is accomplished by the addition of divinyl benzene. And here we can also see that they are insoluble in various common solvents like water. So they are hydrophobic in nature. Now we will see if you have to prepare the resinate, then the drugs that you are using, it should have some criteria for the selection of drugs. So in that, the nature of the drug should have acidic and basic groups in their chemical structure. If the drug has these groups, then only it will form ions which will be exchanged with these cationic and anion exchanges. Then the biological half-life of the drug should be between 2 to 6 hours. If it is less than 1 hour or more than 8 hours, then it is difficult to formulate these preparations. And we know that the drug should be absorbed from all the region of GI tract. So accordingly, we have to select the drug, and the drug should be stable sufficiently in the gastric juice. Now we will see what are the advantages of these resinates. This is advantages for the drugs that are highly susceptible to degradation by enzymatic process. It prevents the degradation of the drugs. Then the preparation cost is very low. Then it requires little energy, and regenerated chemicals are very cheap. Then it is seen that if the resin beds are maintained properly, then we can reuse them for many years before replacement. Then these resinates can help in reducing the dose of the drug. Then reduced fluctuation in blood and tissue concentration level could be achieved. Then protection of the drug from the gastric enzymes and controlled release of the drug could be achieved. These are the advantages of resinates. There are some limitations also. The release rate is proportional to the concentration of the ions present in the area of administration. So, accordingly, the release rate of the resinate will be altered. Then the release rate of the drug can be affected by variability in diet, water intake, and individual intestinal content. And the third and very important one is the dose dumping, that is uh, complete release of the whole drug could be possible. That is also a serious problem that has to be overcome while preparing these resinates. These are some of the examples of the iron resin that you could see along with the polymer bone and commercial resins. Here you can see strong, weak as well as both type of cation and anions which are available. Now we will see the properties that we have to take care of while selecting a suitable ion exchange resin. So in that the main properties are: first is exchange capacity, it should be high, then degree of cross-linking in resin matrix, particle size of resin, nature of the drug, site of drug delivery, swelling ratio, acid-base strength of the drug and porosity. These are the important parameters that we have to check before selecting any suitable ion exchange resin for the delivery system. The other factors that affect drug resin complex are pH and temperature of the drug solution, molecular weight, charge intensity, degree of cross-linking, particle size of the ion exchange, ionic strength of the drug, and the nature of the solvent. Now we will see the method of preparing drug resin complex. Initially, the resin is properly purified, and after purifying, the changing of the ionic form occurs, and the important drug resin reactions are like if the resin is with positive charge and the drug is negative, if it reacts with X negative, then what happens is instead of drug negative, X negative combines and drug negative comes out. Similarly, second reaction is also very similar with that only. Here the drug is positive and the another ion or drug that is coming is positive. So it will be replacing. We can see that the drug loading is done by two ways or two techniques. First is batch technique and second is the column process. In batch technique, what we do is the resin particles are stirred with a large volume of concentrated drug solution. But in the case of column process, a highly concentrated drug solution is eluted through a bed or column of the resin until the equilibrium is established. In this way, the drug loading occurs. Now we will see the pharmaceutical applications of ion exchange resin. First is the stabilization. There are various drugs which get degraded and those drugs can be stabilized with the help of these resins. For example, vitamin B12 has shelf life of only few months, but the resinates are stable for more than 2 years. Similarly, nicotine degrades in air and light, but the resinate used in nicotine chewing gums and lozenges is much more stable. So stabilization is the important application. Second comes tablet disintegration. These resins have excellent swelling property, so they are used as tablet disintegrating agents. One of the good example is Indion 414, which is very nice super disintegrant and is used in mouth dissolving tablets. Third approach is or third application is extended release. Some of the resins are formulated with required particle size, degree of cross-linking and functionalities for specific drug release. So the release will be uniform, prolonged and predictable. Now fourth and most important application is application related to drug delivery approaches. First is oral drug delivery. We can see that drug diltiazem, the sustained release suspension of this diltiazem is very well prepared using strong cation exchange resins for the preparation of microcapsules. Then second is nasal drug delivery. A novel nasal formulation as nicotine amberlite resin complex powder provides an optimal combined pulsatile and sustained plasma nicotine profile for smoking cessation. This is very nice controlled delivery system that is developed for nasal drug delivery. Third is transdermal drug delivery. We can see the drug ketoprofen. The release rate of ketoprofen from carbopol based gel vehicles containing ion exchange fibers has been found very high as compared to plain conventional simple gels. The fluctuation of release was very much controlled. Fourth is ophthalmic drug delivery. When we use the complexation of beta-xolol hydrochloride drug, which is an anti-glaucoma agent, with ion exchange resins having carbomer 934P as a polymer, then a higher or increased bioavailability was obtained and the suspension was also very elegant. There are few more examples that we have to study in the applications. Fifth one is anti-deliquescence. First of all, we must know what is deliquescence. Deliquescence is defined as the conversion of a solid substance into liquid due to the absorption of water vapor from the air. The example is drug sodium valproate. It very much easily absorbs water from the atmosphere. But if we make a complex with the ion exchange resin, then the drug is very much free flowing and the amount of water absorbed decreases. Sixth is polymorphism. If we prepare a drug resinate, it is an amorphous solid, and we all know that amorphous means the solubility is increased because as compared to crystalline form, amorphous form requires less energy to break. So the use of resinates can eliminate the problem with polymorphism also. Seventh is antacid preparation. When we make iron resonate antacid preparation with a drug, then a controlled gastric acidity is obtained, which is used in the treatment of peptic ulcers. Next application is powder processing aid. We know that hygroscopic drugs, they are also susceptible to agglomeration due to the presence of moisture. So by making the complex with ion exchange resins, the hygroscopicity also decreases and the flowability increases. Ninth is the poor dissolution. The drug resin complexation converts drug to amorphous form, and amorphous form shows faster dissolution. And also you must remember that ion exchange resins themselves, they were hydrophobic, but the matrices, they are hydrophilic. So they allow enhanced dissolution rate. Next application is taste masking. Bitter drugs are easily taste masked using ion exchange resins. These are some of the examples of resins along with the drug. You have to remember the name of resin that is used for the taste masking of which drug or which of the like for example here ofloxacin, norfloxacin, for them indione 204 is used, for azithromycin 214 is used. Similarly, these examples you have to remember. We have already made a video related to polymers, but these are the example of some of the polymers which are used with resins. These are acrylics, cellulose acetate phthalate, ethyl cellulose colloidal dispersions, ethyl cellulose wax, gelatin-based polymer complexes, and hydroxypropyl methyl cellulose. Here, cellulose acetate phthalate, you just remember, it is often used for enteric coating. Now before ending, I will just give the examples of some of the drug delivery systems which are prepared using ion exchange resins. First one you can see indione 244. This is used with drug bromohexane and the type of system is microencapsulated resinate. Here the control release of oral liquid suspension was formulated. Similarly, the second Dovex 1X2 here this is the ion exchange resin used for diclofenac sodium. Here also type of system is microencapsulated resinate. So in this way you can see we have just summarized 6 examples for you. These are 3 and coming also you can see tables of 3. These are another 3 examples of drug theophylline, then CPM maleate and fluvastatin sodium. In this also microencapsulated resinate is prepared. Especially this is used for controlled purpose. So dear students, thanks for watching. Keep studying, keep learning. Do like, share and subscribe the channel SRIP Edu Pharma. Hope you have understood our topic, ion exchange resins, their applications as well as their properties. Thank you so much.